Thank you all for being here. My whole family is here. I'm going to point that out. I'm just so glad they're here. My wife, beautiful wife, is here, who endured many mornings of long walks and runs where I talked about the insanity of putting my prices online. And she can tell you anything that I can. Thank you. For the medical students here, you guys are spread out. I would wish for you the medical partner that I've had, Dr. Steve Longshire. I get FaceTime and credit, but Steve and I are in the trench together. Believe me, the two of us have done this together. One more personal note. Dr. Jane Orient is here, and everyone in the room knows who she is. I mean, she's a legend. Back in the Clinton healthcare days, when that was being considered, she single-handedly destroyed that. I call her Jane of Arc. Jane and Jeremy, thank you for coming and making the trip. That's made it very, very special for me. Welcome all of you. I know I speak for Charles and Jay when I say we're honored and frankly moved that so many of you have taken the time and trouble to attend our first and I think historic conference. While there are many distinguished guests here, I hesitate to even try to point them out. I've done a little bit, but I'll stop there. Many in this room are blessed to be in a position where, having embraced free market ideas, they've had the opportunity to implement them. Watching these ideas come to life, empowering actual healthcare consumers. Thanks to the courageous efforts of both the buyers and the sellers of healthcare in this very room. These ideas are no longer some economic theory, but rather the free market models that are producing the effects and results so many are attempting to emulate all over the country. I believe that what distinguishes the approach taken by the enlightened in this room, as opposed to all the others in healthcare, is a focus on cost, not a focus on coverage. Coverage is an afterthought, after all, if the prices are reasonable and affordable. I believe that to understand the nature and origin of healthcare pricing is to understand the nature and origin of this association. And so for the next few minutes, I'd like to share some thoughts that I've had about pricing, its power and effect. How many of you have experienced anger or frustration when a car dealer has revealed to you his desired price or what he thinks the trade-in allowance is for your vehicle? How many of you have exclaimed that's robbery when confronted with restaurant pricing on the menu? I would propose to you that we've been conditioned to react emotionally rather than rationally to prices, conditioned to see prices as a ripoff or an act of desperation, rather than what they are. Prices are simply signals. Signals sent by the sellers in the world, always a reflection of their perception of the scarcity or abundance of what they're selling. That the vast majority believe that this signal-sending price system, which is present in every other industry, does not or cannot apply to healthcare, largely explains why we're in the mess that we're in. Imagine the disorder and chaos resulting from the purchase of an automobile if the price was unknown to you until after the sale. The car dealer would be considered unethical for conducting his affairs in this manner and would be inclined, hiding behind a price shroud, to find out what he could get away with. But doesn't this describe the vast majority of healthcare purchases in this country? I do not mean to disparage the car dealer. As offensive as you may find his pricing, at least he shows his price to you before you have bought the car. Ethically, this places him in a more favorable position than hospital systems, which unleash a bankrupting blitzkrieg of charges only after the point of sale. I come to the conclusion that it is the ethical and moral obligation of the seller of healthcare services to provide the prospective buyer a price in advance of provision of the service. Any other way of conducting medical business affairs has the feel and characteristics of a bait and switch. While many maintain that the provision of advanced pricing is impossible, those of you gathered here now know without a doubt that this claim of impossibility is a lie, an excuse to fleece the buyer, and an excuse that is frankly no longer credible. Likewise, it is not the obligation of the buyer to root out the seller's price, as this cumbersome method of value discovery serves only the interest of the seller, not the buyer. In no other industry is the buyer placed at such a disadvantage as in healthcare, and in no other industry is it more important for the buyer to possess every bit of knowledge that he can. Ascertaining value is impossible, and comparison shopping is futile in the absence of transparent pricing. I confess that my first inclination a few years ago was to find out what the buyers of healthcare were paying to the hospital systems, and with that as a comparison, beat their price. Imagine, however, asking a car dealer his price, only to be asked by him, what other prices have you been quoted by the other dealers? Or as Adam Russo said, why would I ask how much is a medical procedure going to cost, and I told them to show me my card so they can answer me? Thankfully, I realized that I needed to make the first move. Further, I needed to reveal my pricing to everyone, not just a select few, and for this pricing to hold for everyone, regardless of any number of patients referred. Many of you now realize that these price-revealing actions have allowed people to purchase care they previously assumed was otherwise unaffordable. People who had neglected their health entirely based on the lack of visible pricing. We've accepted the proceeds of church bake sales at our facility. Successful fundraisers only because they had a target price. As an aside, on one occasion, Dr. Longley and I refunded our anesthesia fee so a family could buy the gas and food they needed to return to South Carolina with their child on whom we had just operated. Economists refer to the market clearing price as that price where the buyer and seller have each achieved a maximum position. This means that at a lower price than the market clearing price, the seller walks away. And at a higher price, the buyer walks away, the transaction no longer feeling mutually beneficial. How can the buyer rationally proceed without knowing any price at all? The predictable result of price opacity is a constant rise in prices, as the sellers continuously over time take advantage of their position, stretching the limits of what they can get away with. And when any price crisis or disaster strikes, who then rides in to rescue us from our own folly? Our good friends in Washington. They never let a crisis go to waste, do they? It turns out the only thing worse than no price transparency at all is a price from the government, which is arbitrary and frankly wrong. The notion that some brilliant bureaucrat is capable of discovering, much less imposing, a market-clearing price on the actors in the healthcare marketplace has proven to be a bankrupting experiment. The fallacy of government-imposed pricing is very recent and a product of the ideas of Karl Marx. It should come as no surprise that the same bankrupt government that has so corrupted the medical marketplace here now wants even more price-setting power. True, rational, and market-clearing prices always emerge from competitive activity. They are never imposed. How can price competition occur, however, without visible prices? It is the simple yet bold action of many of you in this room, freely revealing or even posting your prices for all to see, that has broken the stranglehold on the free market in healthcare. Interestingly, I owe much of my understanding of prices in the market to our incorruptible friends in Washington. How many of you believe $278 is too little to pay an anesthesiologist for 6 hours of his time for an open heart surgery? Or $78 for a total knee replacement? These payments, although instructive to me, were the last indeed that I received for Medicare. After accounting for overhead and taxes, it was clear to me that I was likely paying for the privilege to participate in the care of his patients. Criticized by my anesthesia partners for walking away from Medicare, I remember rhetorically asking them when they would quit, when they were paying to do the cases. Incredibly, that moment had arrived, and it was time for me to better understand the sick situation in which I found myself. It was no time for anger. I could complain about this for the rest of my career. I could do something about it. Fortunately, by that time, I'd come to see prices as the signals they were, and I felt obligated to respond to the folks at Medicare with a signal of my own. I quit. To continue providing services at these below market clearing wages would be to send a signal, would it not? One that indicated that I viewed the transaction as mutually beneficial. In my view, to send the wrong signal by continuing to work at these wages was an error. To sanction the bureaucrat as a capable price setter was even more troubling and dangerous, though. 130% of Medicare means absolutely nothing to me, and should be considered illegitimate for everyone as an arbitrary number, the justification for which is absent. We have allowed the bureaucrats and apparatchiks to issue medical pricing from their ivory towers for many years now, all leading to the irrationally priced disaster we know as the United States healthcare system. Distortion of the proper signals regarding what was needed in the marketplace, what was present in overabundance. The complicated dance of the marketplace has been thwarted. The high price of healthcare in this country represents no failure of the free market, but rather the absence of market discipline. Shortages of items like toilet paper and shampoo have been commonplace in command economies like Cuba and the former Soviet Union, all due to the lack of market prices. This is healthcare in the United States, after all. Whereas recently revealed in Michigan, outrageously priced chemotherapy treatments were administered to patients who lacked a cancer diagnosis, and badly needed treatments and surgeries remain unavailable to those in desperate need. In Great Britain, the same government entrusted to provide their citizens health care by their own admission decided for budgetary reasons to murder hundreds of thousands of sick people, a bounty paid to their hired doctors for each patient sent to euthanasia's death row. As evident in every other industry, the free and competitive health market would have driven the actual cost of the care down to levels that would have likely spared these people's lives. Cost is the issue. The market, not more heavy-handed government, is the answer. No discussion of healthcare pricing would be complete without a review of the repricing scam of carriers. Insurance companies must love you. I've been told this many times, even though nothing, as you all may imagine, can be further from the truth. They actually hate us, as a significant portion of the revenue comes from charging for the discounts they can achieve on fictitious medical bills. The higher the bill, the greater opportunity for a big commission on a discount. This is one reason the carriers love the big, expensive hospital systems, and one of the primary reasons they want nothing to do with those of us who display our pricing. They are provided no opportunity to reap this repricing revenue when the prices are revealed up front, after all. I'm familiar with one contract we have had with a carrier that actually proscribed and prohibited any honest pricing that interfered with their ability to reprice and therefore profit from the claims filed. The hospital systems are all too happy to produce these giant repriceable bills, knowing all the while that they will only collect a fraction, as the sea of red ink is necessary to maintain the fiction of their not-for-profit and therefore tax-exempt status. These fictitious losses also form the basis for their uncompensated care kickbacks from the taxpayers. These scams represent opportunities seized by the predators in healthcare, made possible only by a price-opaque and non-market system. There's a point that I wish to underscore in this discussion about medical pricing that cannot be overemphasized. That the entrepreneurs, physicians, and buyers in this room have elected to post prices based on the cost of providing goods and services in the absence of competitive pressure to do so is truly remarkable. That these prices are many times a tenth of what the so-called not-for-profit facilities inflict on the sick is even more remarkable. The result is that the moral and ethical argument has been won by those in healthcare who are unapologetically embracing the principles and discipline of the market, providing care to those who could otherwise not afford it, and sparing so many bankruptcy. A downstream result many of you may not realize is this: reasonable priced and high-quality healthcare has rendered this issue nonpartisan and has brought many who have previously derided the workings and the magic of the market to take a closer look. In short, theoreticians can study the market and write about it, but to implement market mechanisms and to see them act so predictably and powerfully makes the strongest argument for market freedom in all areas of the economy. One mother, who revealed herself to be extremely opposed to my philosophy, but who nonetheless brought us her child for a tonsillectomy her family could afford, asked me the following question: how can you argue with cheaper and better when those who are paying their own health care bills are flocking to the physicians and facilities they know will not bankrupt them, and they then tell everyone they know about their experience? The market begins to inflict its discipline on even those who so seriously work to avoid it. This is the tremendous power wielded by those of us here. But it is a power of persuasion, a consenting dance, shared by the actors in the marketplace, not the violent power of the government and its cronies. I've recently stated that many of the big healthcare systems act very much like Mexican drug cartels. Little or no tolerance for competitors being the rule. Certificate of need laws, contracts with insurance carriers that routinely single out competitors to be excluded, stacking deductibles for out-of-network care, purchasing referrals by buying physician practices. There are countless other barriers and bribes placed in the way of would-be competitors that have allowed the cronies in healthcare to limit their exposure to the competitive market discipline that is at work in every other industry. But when a patient in Houston demands that their local hospital step up and match pricing for a surgery he or she has found in Oklahoma City, this serves as notice to those working so hard to stifle their competitors that they are indeed in the middle of a revolution, a free and competitive health market. When a patient in Georgia, having successfully negotiated a surgical price from $40,000 to $4,000, using the pricing on our website as leverage, tells me that we have indeed saved him $36,000 and we didn't even perform his surgery. When that happens, that Georgia hospital realizes that this could indeed get out of control if a new day has arrived. When a patient tells his doctor, who is an hospital-employed doctor, that he or she is going to a price-transparent surgeon or facility because his employer will pay the entire bill, the cartel-like arrangement that hospital system has worked so hard to perfect begins to unravel. When self-funded employer groups carve out arrangements with facilities like mine and many others, shoving their carrier and PPO aside, realizing they can do far better on their own, this courageous move works to serve notice that a new day and a new way has indeed arrived. That the millions saved by companies that have taken these steps is now public record, available for all to see, has silenced the chicken lips the giant corporate healthcare elites whose bullying days with their clients are numbered. My friend Steve Kelly in Philadelphia once told me, good things happen when healthcare buyers and sellers are in the same room. He was pointing out that the absence of the price distorters, the ticket scalping intermediaries, as I like to call them, inevitably leads to more rational pricing. The direct price negotiations to which I've been a party here in Oklahoma City, even involving a full-service hospital, Deacon's Hospital, have proven Steve Kelly correct. Indeed, this association, this Free Market Medical Association, serves that purpose as a Match.com, providing an uncontaminated forum in which buyers and sellers can meet. Physicians and facilities can take solace from the fact that this association's membership is currently dominated by the buyers, an indication of the huge market for honestly priced medical services. This demand will not be remotely satisfied in the near future, as the success, once apparent and publicized, brings even more demand, as we've found. The fist of government, the fist, has brought us the murderous National Health Service in Britain and Obamacare. Neither system born of or guided by the principles of the market. The market and its miraculous system of price signals brings us the good news in healthcare. The higher quality, lower prices that always emerge from the competitive nature of mankind. As I've said, the Free Market Medical Association will serve as the meeting place for the buyers and sellers to interact. Without the intermediaries, bring nothing to the table. This Free Market Medical Association, the caretaker of price transparency, will bring not just ideas, but market solutions to this cartelized industry. The courageous souls in this room, all of you, are the early adopters. The source of the good news revolution in healthcare, all revolving around a clear and cogent understanding of the relationship between markets and pricing. We are just beginning, however, as the interest in these ideas is growing at an impressive rate, embraced by people all over the country, as evidenced by how far many of you in this room have traveled here. In this room are the people who have brought the power of the competitive market back to healthcare and have done this in spite of intense opposition from government and their crony pals. I predict that not long from now, we will look back to this gathering as the beginning of the great healthcare price deflation, the result of the market unleashed, the result of the passion and the principle of those in this room. Thank you. Are there any questions? We have time, don't we? Any questions?
Encore.
What?
Their piano up there?
Would not be as good as the remarks. Ralph?
Keith, you're familiar with your own state senator, Mike Mulroney, right? Are you?
Mike who?
Mike Mulroney from 1954.
Oh, yeah.
Mike Mulroney passed the Mulroney Act, which called for the manufacturer's suggested retail price on cars. Because before that, you go from dealer to dealer and have tremendous variation in pricing. He passed it in 52 to 55, the Mulroney Act. And they're still to this day called Mulroney stickers.
And you're suggesting?
Well, because you talked about, you spoke about car dealers. I think it's a good thing to use as a comparison. You know, the old state senator passed this.
Yeah, I'm actually,
There you go.
yeah, I've actually got a problem with mandated transparency as the Rothbardian that I am. I love hearing young people. My fear, you know, we had a bill in Oklahoma this year that mandated price transparency, and I opposed it. And the hospitals just danced a jig. They couldn't believe I would oppose it, but I met with the author. He made actually a pretty compelling case for it. He said, well, most of the money they receive is government money, so they're government institutions, and they are subject to oversight and control of the government, therefore. I said, yeah, you got a point. However, mandating transparency, because I'm so cynical about what the government really does and how it works, I'm afraid provides an opportunity to actually redefine the word transparency. I heard Ed Robbins call something transparency a drag. That's what it would look like. The other problem is the way the government is set up is it would afford the big players to basically purchase exemptions. So we have a demand to provide price transparency, and then the big boys would just pay their way out of it and not do any of it. I mean, there's a law in California that requires posted prices, and they kind of don't even do it, or they post it, like somebody said earlier, here's our gallbladder price, but we don't do gallbladders here. So. Any others? Yes. Doctor?
About a month or so ago, Walmart announced that they were going to start opening clinics and doing visits, third-party free visits for cash for $40. What do you think that's going to do to the insurance companies? How are they going to justify what they charge, the inflated bills going to see your primary care practice, for $150, $200, $300 when Walmart can do it for $40? Do you think that's going to be a game changer like it was when they started the $4 prescriptions?
Yeah, it's hard for me to predict. I don't know. I think that our having a price online for $3,740 for a knee arthroscopy, when right across town it's $32,000, and Blue and United and Cigna and Aetna and Humana are happy to pay that, and they actually have contracts that exclude us, with one exception. So I don't know. I mean, it's so in a normal market. What you've said, yeah, it would crush them. They would have a lot of explaining to do, but it's a cartel. It's not a free market. It's not a place where prices exert their power the way they normally would, because people have not been willing to be honest and upfront about what they are. But it's a start. It breaks it down. Yes, in the back.
You've been so instrumental in not only publishing and leading out in your own practice, but expanding that in training and mentoring so many other organizations. Do you see the Free Market Medical Association as helping you facilitate that, or,
Yes.
or do you have other goals for the organization?
Yeah, that's one of my main goals, because I get so many emails and calls from physicians and facilities. How do we do this? And at first they can't believe I'm happy to tell them. But this is important. And I saw this association, one of its missions as being a resource to those who wanted to copy us. Because Corey Cook is here, Adam Russo's here. I mean, they're in the background, but they're pounding the pavement and doing some of the hard work on modifying employer plans so that the patients and the employees can actually get to the transparent providers. So it's important for the physicians in here to understand what they're doing, and it's a big game. It took me a while to understand half the alphabet soup. When I went to the TPA, the SPBA meeting, I understand half of what they said. I nodded a lot, but I learned a lot of it. But yes, this will be a resource, an educational resource, and there will be contacts in here. I mean, if a large self-funded employer shows up at this meeting next year and they look at somebody's name tag and say, hey, I'm from Oregon too, and well, how can we do what these other guys are doing? Well, let's talk about it. Well, necessity is the mother of invention. So then it becomes a matter of, well, it's not can we do this, it's how do we do it? And I think all the resources are here, and that's what gets me so excited about this, because my thought was, I want everybody to do this. And then Steve and I, Monty and I, can compete with everybody on quality, and then God help you. You've seen our prices. Other questions? Yes, doctor?
We hear stories that one of the major health systems in the state, are going to start trying to undercut these prices in probably a predatory fashion. How do you think how would you all react to that if they come out with significantly lower prices that they can obviously subsidize for a period of time?
If that's their plan, they don't get it. Because as Dr. Rice pointed out, this is a value proposition. Mike Rogers is still here, isn't he? Mike's here. Mike will tell you that while the money that his institution has saved in their relationship with Jake Hempton and us, that's part of it, but maybe as bigger part is the service and the quality that the patients and the employees that come to us receive. So, I mean, if somebody wants to undercut us on the price, I would be the first one to point out that for prices that low, it can't possibly be any good, because that's exactly what they said about us. Anybody else? Well, thank you for your attention. Jay and Charles and I are just thrilled that you all are here and honored and, like I said, moved that you all have come from so far to attend the meeting. Tomorrow will be fabulous. Do not be late. If you get there on time and you hear Adam Russo, you realize you didn't need your coffee. We'll see you tomorrow. Thank you so much.